Let's take you to this conversation now. The Commission for Gender Equality will, on Tuesday, the 28th of September, launch a national campaign to solicit public comments and contributions on the state of LGBTQI plus equality in South Africa. The comments will be used to identify key areas of intervention for the CGE to ensure the achievement of the LGBTI plus community equality in South Africa. Now, to tell us more about this campaign, we joined via Zoom by Commissioner Busisiwe Deyi. Busisiwe, good afternoon to you, and thank you so much for your time this afternoon.
Good afternoon, Unati. Thank you for having me.
Now, before we talk about the campaign on Tuesday, perhaps let's start here. What critical interventions around oppressive gender systems have you made since your appointment in 2019? I know that you were appointed with 8 other commissioners. I'm particularly interested in sectors like health, education, and perhaps even other socio-economic sectors where gender norms are used to exclude the LGBTQI plus communities.
Well, this project, Unati, is part of beginning that intervention. As you know, the CGE, whilst it has expensive powers, it also has the responsibility to ensure that it acts on facts. So this is part of the preliminary investigations that the CGE will have in order to identify the areas of concern. We have had various NGOs and various public individuals come forward to the CGE and lay complaints on various issues. Issues such as repressive therapy, issues such as intersex genital mutilation. And through those individual complaints, we've identified what we call loopholes in the law. For instance, with intersex genital mutilation, whilst there is a ban on female genital mutilation, there isn't a recognition of intersex genital mutilation. So as the CGE, in order for us to make proper legislative investigations and interventions, we have to have the relevant information and we have to identify the appropriate stakeholders to carry out these interventions. So this program is a commissioner-led program. Each commissioner is entitled and has the responsibility to champion a cause. Mine, as you know, is LGBTI plus rights. And part of that agenda, let's call it, is to ensure that the CGE begins to take very concrete steps in making the appropriate recommendations to the various stakeholders.
Now, Busisiwe, one would appreciate that you are talking about systemic issues here. But then there's also that question of, you were appointed in 2019 and in 2021, it's only now where we're going to various stakeholders. Perhaps talk to me about what has been the delay, because we know as it stands, people in the community are suffering as it is.
Well, there has not been a delay. When we were appointed in 2019 as the new cohort of commissioners, there was work already in progress. That work, due to resources, due to other human resource structures, has to be completed. As you know, we had a very big investigation into the forced sterilization of women. It had broad, sweeping recommendations for the Department of Health. So therefore, we've had to ensure that we follow up on that. Various political parties have been rightly calling on us to follow up and to ensure that we address this issue in much more concrete ways. And therefore, we can't leave the work that was done by the previous cohort because we have our own interests and our own agendas. We have to finalize those commitments and move forward in a programmatic way that utilizes the resources, the very limited resources of the CGE, in an effective manner. So what you're seeing now is this new cohort of commissioners finally having the financial and the human resources to implement their various focus areas. You would have seen various webinars that are coming up led by various commissioners in the CGE. So that is part and parcel of the work. It has to be done in a manner that ensures that we reap concrete and material results, and we don't leave things up in the air in order for us to rush into, our own interests, which will leave questions. We have to finalize everything. So I think that is the way in which we have been accountable for that. In our annual reports, we've also finalized some of those reports, and they've been brought before Parliament for adoption and for actioning by Parliament and by the CGE itself.
Imagine a lot hangs in the balance in terms of some of the things that you will uncover. So talk to us then about this launch. So on Tuesday, you're hoping to engage the LGBTI plus community on the state of equality or lack thereof. Talk to me about that process and how it will unfold, as well as the timeline.
Well, on Tuesday, we will be launching the questionnaire, and we will be launching the call for contributions, which explains the reasoning and also what the outcomes of the report will be, what tenable results will be achieved from people's contributions. The report will be publicized on the CGE's report webpage, and some of the contributions where organizations and people have given us the go-ahead will actually be posted up on the website. So as people make their contributions, they will be posted up on the CGE website in order to ensure transparency, accountability, and the truthness and veracity of the outcome report. From the report, then, we will begin to initiate and identify how we can intervene in the various issues. As I said, some issues might require legislative reform. So we need to engage with our fellow Chapter 9 institutions as we are mandated by our CGE Act and the Constitution, such as the South African Law Reform Commission, and say we need, as the CGE, legislation on anti-gay therapy, for instance. New Zealand has a new piece of legislation that we wish to begin having dialogue around that outlaws anti-gay conversion therapy. We also want to ensure that we close the loophole in relation to intersex genital mutilation. I don't think anyone in this country would disagree that it is important that we begin to ensure that intersex children or children born intersex no longer are subjected to non-surgically necessary, medically necessary interventions. We also have to look at access to health for transgender people. We know that there's a 25-year waiting list. It's widely reported. At Grooteskier, we have to look at what health insurance companies are doing and why there is this key exclusion of transgender people. We have to engage with our fellow institutions at the same levels and ask them to intervene in much more concrete ways and follow up. So we will have to identify each issue and each matter of concern, and we have to then move forward by engaging our various powers, whether it's to monitor, whether it requires further investigation, or whether it requires legislative reform. As the CGE, we will then take that up into our APP, annual performance plan, and then we will execute and dedicate funding and resources, human and financial resources, to ensuring that those particular interventions are carried out so that by the end of my term, I can say to the public that I'm accountable to and the Constitution that I'm accountable to, that here are the legal interventions that have been made through my work by the CGE. Here are the changes that we hope to see. And here is what the CGE can continue after I've left as a commissioner to ensure that there are concrete results and that we hold the right stakeholders accountable in relation to those interventions.
Busisiwe, as we close this interview, now I know that your term ends in 2024, and I mean the plan that you're now trying to develop will be one, hopefully, that will be implemented soon in this country. But just talking about that part of implementation, we know that our constitution, particularly where it speaks to equality, is hailed as one of the best in the world. But therein lies the problem where we are not seeing it being practiced. Do you have faith that this country will then start to implement some of those changes that you will hopefully, table through the process that you will be embarking on from Tuesday?
That's a very difficult question, Unati, because it...
Oh, no. Busisiwe, are you still there? All right, we seem to have lost Busisiwe as I was asking her that very final question about implementation. Of course, Busisiwe Deyi is a commissioner with the Commission of Gender Equality, and on Tuesday, her part of the process they will be embarking on Tuesday, the 28th of September, is launching a national campaign to solicit public comments and contributions on the state of LGBTI plus equality in South Africa. But let's move on to this now.